So with that, I would like to introduce our first speaker for this afternoon, Victoria Schmidt. Before joining Switch BC, Victoria was Vice President of Pandemic Planning and Executive Lead Experience for Island Health, where she led the COVID response and immunization efforts of 30,000 staff, medical staff, and volunteers to support a population of more than 860,000 people. Victoria is a certified dietitian with a passion for change leadership. Early in her career at the Saskatoon Health Authority, Victoria was the provincial lead for safety and created a provincial safety alert system that brought staff safety and patient safety together. She supported the development of a provincial health safety management system that's now implemented across Saskatchewan. Victoria is using those learnings at Switch BC. Please welcome Victoria Schmidt.
Awesome, thanks so much. It is just so great to be here today. Thanks for the introduction, and thank you for inviting Switch BC to be part of this really important conversation today. If any of you have been reading the papers lately, I know you'll have seen the headlines on the violence that we're seeing across the world in healthcare right now. During the pandemic, I was exec on call one morning when I got a call at 4 in the morning that there had been a shooting in one of our emergency departments. And so we're definitely seeing an increase in the violence in healthcare. And while violent incidents in healthcare aren't new, the types of incidents we're seeing an increase in, an increasingly agitated public taking their anger out on healthcare workers, that is new. And so we know we need a new way of dealing with these incidents. And that's why conferences like this are so important. And I'm really excited to be here today to learn with all of you. I'd like to open by acknowledging the Indigenous peoples of the lands that we're on today. While we're meeting on a virtual platform, I'd like to take a moment to acknowledge the importance of the lands that we each call home. At Switch BC, we do this to reaffirm our commitment and responsibility in improving our relationship and understanding of local Indigenous peoples and their cultures. And so from coast to coast, we acknowledge the ancestral and unceded territories of all the Inuit, Métis, and First Nations people that call this land home. It's also really important to acknowledge in healthcare in particular, the effect of residential schools, Indian hospitals, and ongoing colonialism on Indigenous families and communities, and to commit to move forward in a spirit of reconciliation and collaboration. We're all here today because we care about the safety of healthcare workers, which includes so many security professionals. You may have seen in BC that we're really looking to add to the number of security professionals that we have working in healthcare. And there's been a call for the hiring of another 320 FTE of security professionals to support our healthcare system. Switch BC, which stands for Safety, Wellbeing, Innovation, Training, and Collaboration in Healthcare, is a new organization in the BC safety space. We originated out of 2019 collective bargaining conversations in response to a need for a provincial focus on worker safety in the healthcare sector. And we've been operating for just under a year, but we're committed to provincial solutions for health, safety, and well-being that support the close to 330,000 healthcare workers across BC. We work provincially to support and resource innovative approaches to improvements in workplace safety. Our board is also unique in that we have employers, unions, and physicians as equal partners in this work. We're supported by WorkSafe and the BC Ministry of Health. And so as you can imagine, coming to consensus at a board with this type of partnership is not always easy. However, the benefit of this is that once consensus is reached, we have a much higher rate of implementation success for our initiatives within the healthcare system. And while we're new in this space, our team is made up of safety experts who have years of knowledge and experience in occupational health and safety in the BC healthcare system. We have two strategic objectives: to promote and support safe workplaces across the health system by developing a culture of safety, and to develop and implement a provincial data system to drive improvement and innovation. We're focused on multiple areas of work, from prevention of musculoskeletal injuries, addressing psychological safety in the workplace, to building a provincial data system and supporting the implementation of a health safety management system for BC. My partner is an ER nurse. So I know firsthand the impacts that violence in healthcare have on the individuals who work in healthcare and on their families. And because of this, one of the areas that I'm most passionate about is our work on violence prevention. So today I'm really excited to tell you a little bit about the work that we're doing to update the provincial violence prevention curriculum for the people who work in healthcare in BC. But before I do that, I want to tell you a little bit about a paramedic that I know named Jason, who works in downtown Victoria, BC. And while his story is his own, unfortunately, I don't think it's unique. In talking with your teams, you've probably all heard similar stories, regardless of what industry you work in. Jason's been a paramedic for 12 years. And while he knows that the risk of violence has always been part of his work, he's definitely seen an increase in aggression and violent behaviors in the past few years. Like many of you across Canada, in British Columbia, we're grappling with the impacts of an ongoing drug poisoning crisis that since 2016 claims at least 6 people a day in our province alone. We've had climate change catastrophes. We're experiencing and acknowledging the racism in our healthcare institutions. And we have an ongoing COVID-19 pandemic. We also are seeing increased pressures on our healthcare system that's already in crisis. And through these past 3 years, Jason has noticed that people are getting more volatile. So as the world becomes more polarized and we witness what the New York Times is calling a global tide, a growing tide of global sadness, people are becoming meaner, less tolerant, more violent. Like many of us, Jason got into healthcare because he wanted to help people. But he told me that most days he feels more like he's seen as a system that people need to fight against rather than a person that can offer support. He faces verbal assaults every single day on the job, and he's physically assaulted several times a month. His work is changing as the people that he tries to help are not only dealing with the compounding pressures of their medical situations, but also with the other stressors in their daily lives as people struggle more and more just to get by. Jason's story highlights for us how the world around us is quickly changing. At Switch BC, we have a mandate to support the health, safety, and well-being of anyone working in healthcare in BC. And to support the changes that we're seeing in the world around us, we know that the training that we provide has to change as well. In BC, violence prevention training is required for anyone working in healthcare, and that includes security professionals. We're also working hard to ensure at Switch BC that the security professionals who are a vital part of our healthcare teams have the same training opportunities as the other healthcare professionals that they work with. We want them to see healthcare as a potential career and not just a stepping stone to law enforcement. From the porter to the nurses, the physicians, the care aides, and the security staff who are posted in our clinics, our care homes, and our hospitals, we're one team. We believe that everyone working in healthcare has the right to be safe and healthy, to thrive on the job, and to go home safe to family and friends. Like Jason's story shows us, incidents of violence are really high in healthcare. WorkSafe BC reported in 2020 that 59% of total violence-related claims came from the health and social services sectors. So 2/3 of all the violence claims in BC are coming from a workforce that only represents 11% of the BC workforce. That's a startling statistic. We hear so many stories like Jason's at Switch BC, and we see it in the data. I was surprised to learn that people working in healthcare are 4 times more likely to experience violence than people working in law enforcement and security. Being a nurse is more dangerous than being a police officer. Our partners at the BC Nurses Union found in 2019 that on average, 26 nurses a month are reporting injuries due to workplace violence. That's close to 1 person a day, and that's just in our nursing workforce. That doesn't include security professionals, people working in laundry, housekeeping services, people providing food services, porters, physicians. We also know that underreporting of incidents is very high in healthcare, ironically, because the frequency of incidents is so high. Our teams just don't have the time to constantly be reporting when they're assaulted. Jason told me that he only reports incidents of violence that cause serious physical harm for that exact reason. He can't stop and report every time he's verbally assaulted or when he receives only minor injuries. In my career, I've watched so many healthcare teams simply get back to work after a violent incident and put the needs of patients, clients, and residents ahead of their own. And this trade-off is unacceptable. Exceptional patient care can't be delivered at the expense of our healthcare teams. We're seeing that now, particularly as we face a growing and actually really frightening health human resource crisis in healthcare. We have to do better. Improving the violence prevention curriculum is one of the ways that we will do better. We recognize that healthcare looks very different now than it did 60 years ago when this curriculum was last updated. The curriculum refresh will include a focus on trauma-informed practice and cultural safety and humility principles. Jason told me a really interesting story about how the way he was treated changed when they updated their uniforms. When his work clothes went from the white associated with healthcare to a dark blue associated with law enforcement, he noted an escalation in some patients' aggressive behaviors towards him. I share this story because I think it's a powerful example of how visual cues can influence and escalate a situation. Our teams are better able to support de-escalation of someone in an agitated state if they know how decisions like uniform choices or body language or even the words they use can influence a situation. Applying trauma-informed practice and cultural safety and humility principles to these situations can help. Like many other security situations, understanding what triggers escalation in someone is a really important way of ensuring that our teams can support an environment of safety. The curriculum refresh will also consider the many different work environments and the day-to-day realities of people providing and supporting care in BC. It'll look at how the course is being delivered, what accessibility looks like, both in where the course is offered across the province, but also in what languages are included, recognizing that across BC we speak so many different languages. We're also looking at ways that we can incorporate simulation training into the modality of training that we provide, recognizing that when you actually practice a skill, you're much more likely to be able to call on that skill when you're in a high conflict situation or in a moment of need. Everyone should have access to the same quality of training, regardless of where they work in healthcare. So regardless of where you work in BC, whether it's in rural BC or northern BC, or in the lower mainland or on the island, you should have that same access to quality training to provide you with the skills you need to be safe on the job. We also know that hearing directly from the people who are working at the point of care and delivering care and services will help shape the most robust solutions. And that's why we're asking everyone who works in healthcare in BC, and that includes people providing security services, to help us design a program that really works for everyone. You can learn more and share your ideas with us at yoursay.switchbc.ca. Our work at Switch BC is province-wide, focusing on the systems that support our healthcare workers in all the multiple environments that they work in across the province. This big picture thinking allows us to then support people on a very individual level through the partnerships we have with the organizations across the province. When we all have access to the right education and training, we know that we can be safer in any workplace because we have a common knowledge to work from. That's why it's so important for us to recognize that our security professionals are part of our healthcare team. Research shows that when you bring security professionals into the team, and do combined team training, you have better outcomes and less violent incidents. And so that's one of the pieces that we're committed to at Switch BC, ensuring that we're integrating everyone in the healthcare team with the proper training and the proper practice for that training. We want to equip everyone to manage the situations that come up in a healthcare setting, enable them to protect themselves and to enable them to treat our patients, clients, and their coworkers with respect. And our healthcare professionals and the security teams who support all of the system take care of us every day. That's the work that they do. We need to ensure that we're taking care of them too. We need to work together. For Jason and the many dedicated professionals working in healthcare, providing the right training and working as a team will help everyone go home safe at the end of the day. I'm really excited for this work ahead, and I'm confident it will make a difference. I'm excited to be here today and to learn more from each of you as you share your stories. And I would love to connect with any of you if you want to reach out to our website and contact me. I'd love to hear your story or your ideas for how we make violence prevention training better for our teams in healthcare across this country. Thank you so much, and I'm happy to answer any questions that you might have.
Great. Thank you, Victoria. That was an amazing presentation. As Victoria said, we do have a couple minutes for Q&A. So there's a little Q&A box that you can fill in there. Just record your question, and we can pose those to Victoria now before the next session. Before we take some attendee questions, I'm just curious, Victoria, can you sort of maybe give us a bit more insight as to, like you mentioned, simulation training. Can you talk a bit about sort of the training techniques that you're investigating or implementing? Is it sort of more on the security side with de-escalation, or how are you preparing people to cope for the potential or the eventualities that they're going to see in the actual healthcare world?
Yeah, I'm such a huge believer in simulation training. When I worked in Saskatchewan, a lot of the work we did was actually the first step we did was to actually do simulation training with our executives. And I have to say that I think when we get into healthcare, we don't all come with a set of skills around conflict management or de-escalation. It certainly wasn't a skill set that I had. Through that simulation training that we did, I was able to actually, first of all, learn in a classroom setting what the skills are that you need to de-escalate. I learned different triggers for people and what that meant and how to work through that. But then most importantly for me, I was able to go into an actual simulated scenario. So we hired actors from our local university who actually came in and acted out scenarios that you will often run into in healthcare. Then I was able to jump into that situation and actually practice. And the problem with high conflict situations when we don't practice is that it is very difficult to call on a skill that you haven't practiced. So I often use the analogy of Olympic athletes. We don't say to an Olympic athlete, okay, don't bother training, but now go out today and try to win your event, right? We would never do that. You have to actually continue to practice a skill to get better at it. And so when we put our teams in situations where they haven't had a chance to practice a skill, it is very difficult to do a good job in that situation. So we do a disservice, not just to the patients, clients, and residents that we're trying to support, but we also do a huge disservice to our team. So that's why I'm very committed in this training to make sure that we're not just doing online modules, which we all moved to during COVID. We have to get away from that. We need to get back into the classroom where we're learning skills. And then we have the ability to actually not just practice with each other, but actually incorporate best practice simulation training that we put people through. And I think security professionals in particular should have the first go at using simulation training as part of the training that we use to provide for them to get them job ready, because they are the ones that are at that coalface with violent incidents. And so we have to do the best we can to make sure that they are supported in that situation and provide them with simulation training so that as they go into those situations, they're just using muscle memory. They're not actually trying to figure out what they should be doing in that situation. It's actually just second nature to them.
Thank you. We did get a question from the audience, and I'll just pose it now. How do you anticipate overcoming the issues of getting nursing staff to attend de-escalation or aggression management training, dealing with various reasons to do with their day-to-day, such as needing to be near a bedside or staffing shortages and so on?
Yeah, we don't have enough staff in the healthcare system right now to provide care. How do we pull them out to do training, right? This is not an easy question, and it's something that our teams grapple with every single day. And the polarities that we manage in healthcare is we don't have enough staff, and yet we also know that if we don't put staff through training and provide them with the skills they need to be safe on the job, we're going to continue to lose staff. So how do you manage those polarities? And I think that's where we need to work really closely with our teams who do this work every day, because they actually are the ones that can come up with the best solutions. And it's not going to be easy, but I do think that we need leadership commitment to say, how are we actually starting to really focus in on the key things that we need to do right now to maintain our system, which means we can't be adding a lot of initiatives to the healthcare system. There's not a lot of other things that we can take on right now outside of just providing care and services and keeping people safe. And we have to really be able to focus on that work. And so we've really been reaching out to our teams at the front line and getting their ideas on how they've been able to manage. Some of them do training while they're providing care, and they bring in students to support them, but there's lots of innovative ideas out there. And that's why we really need the support of the people in the health system to help shape the best way forward as we navigate what I think is going to be a really, really tenuous situation in healthcare for at least the next 5 years. I don't see it getting better anytime soon. We're in hard times.
A quick follow-up, I think, from the original question. Will such training be mandatory or voluntary?
Yeah, so in BC, violence prevention training is mandatory. We are starting with high priority areas. So we have high risk areas that we've identified across the system, and then we work down from there, but it is mandatory in BC.
Thank you. This might be more of a comment than a question, but healthcare professionals do complete the mandatory S32 training here in Ontario, Code White and Code Silver training and simulation. Does that jive with your experience in BC as well?
Yes, that's right. Yeah.
Great. Maybe just one more quick question. Your experience during COVID, how did that prepare you for what you're dealing with now? How does it sort of inform your experience, particularly as you're dealing with the prospects of trying to de-escalate violence in healthcare settings?
Yeah, I think COVID has absolutely turned us on our head in healthcare. We knew before COVID happened that we had a health human resource crisis coming. And what has happened is that crisis has just absolutely exacerbated over the last 3 years with the amount of people that we have lost through early retirement, with the amount of people that we lose actually who come in as students and they work a couple of shifts and then they turn around and say, no way, this isn't for me. We just have seen an absolute decimation actually of healthcare staffing. And you have all experienced that, whether you're going in for healthcare services and have had to wait, or whether you work in healthcare and are experiencing this. We're in a really, really tough time. And I think that what COVID has done, though, for us in terms of how we do our work is it has allowed us to think in more innovative ways. So I think one of the things that we learned in COVID is that oftentimes the challenges or the barriers that we thought were in our way weren't actually in our way. So we learned to move very quickly, and we found that we could pull levers very quickly. And so I think those are some of the learnings that we need to take with us as we move into hopefully a post-pandemic state, but we need to think very differently about how we do our work. Healthcare still operates how it was created in kind of the 50s, right? So when you are a millennial or a Gen X or a Gen Z walking into a healthcare setting, you are experiencing a healthcare setting that was developed years and years ago and hasn't been very, very modernized over the years. We need to look at how we change and how we create healthcare workplaces that actually meet what our new generation of workers are looking for, which is more autonomy, more control, more engagement, and more community at work. And we need to look at how we bring those pieces into our work in new ways. And so I think that there's absolutely no easy answer. If there was an easy answer, we wouldn't be in the situation that we're in. But I do think that there are some key pieces that we learned during COVID that we really need to make sure we're carrying forward and really drawing on those learnings as we try to navigate the future of healthcare.
Thank you. We've got 2-3 minutes, maybe just one last quick one. Do you find it difficult to get physician buy-in?
I would actually say it's not difficult to get physician buy-in that violence is a bad thing and that we need to work on it. It is difficult to get physician time for training, much like we see with any of our other staff. However, what we do find is that when we manage to get physicians to the training and then we hear about their experiences afterwards, those are really great stories to take back to physician groups because physicians are then the biggest advocates for the training. So when we do a good job with training and get physicians through, they really see the benefit of it. So that's where we've really been focused on right now, is really finding those physician champions that can go back and advocate for their groups that this is important.
Great, thank you. Thank you for taking all those questions. Very informative, very interesting, fascinating work you're doing in BC, and we wish you all the best as you continue.